Hello, and welcome to our Grand Rounds Safeguarding Our Recreational Waters with the Model Aquatic Health Code. Well, allow me to quickly review the agenda for today's seminar. To begin, I'll provide a few brief announcements, then I will introduce our guest speaker, who has a great presentation planned for all of you today. Following the presentation, we will hold a short Q&A if you have any questions for our presenter. Then I will introduce our expert panelists who will share their experience and work related to recreational waters. And we'll spend a good portion of today in a discussion session where you'll be able to use Q&A to submit any questions that you have for our guests. Lastly, I will close out today's seminar with a final announcement. With that, allow me to cover a few housekeeping items before we get started. Please note that the seminar is being recorded. The seminar recording will be uploaded onto NEHA's Environmental Public Health Grand Rounds webpage, and we will drop that link for you in the chat in just a moment. Please use Zoom's Q&A option to submit any questions that you have throughout the seminar. You should see that option on your screen. At the conclusion of today's seminar, you will receive a link to take part in an evaluation survey to provide us your feedback and comments on today's seminar. So now, for those of you who may not be familiar with NEHA, allow me to provide a brief overview of who we are. As an association, everything we do is to build, sustain, and empower the environmental public health workforce so they are equipped and prepared to protect the health of communities across the country. NEHA supports the environmental public health workforce by striving to provide the most up-to-date trainings, tools, and resources across the many fields considered environmental public health. So if you're not a NEHA member, you should absolutely join us. Professional individuals active in the field of environmental public health, employed in government, uniformed services, and academic or industry sectors pay only $105 a year to be a member. In addition, NEHA hosts an annual educational conference and exhibition, which includes hundreds of sessions focused on all the different fields of environmental public health, like food safety, private water, on-site wastewater, vectors, climate, air quality, emergency preparedness and response, body art, and so many more. This year, we're hosting our AEC in Phoenix, Arizona on July 14th through the 17th. And this year's conference promises to be your oasis in the desert. Registration is currently open, and full conference rates include tickets for our exhibition grand opening and our networking event. This week is Healthy and Safe Swimming Week. During this week, CDC highlights the role that swimmers, caregivers, aquatics and beach staff, residential pool owners, and public health officials play in preventing disease outbreaks, drowning, and pool chemical injuries. This year's theme, Splash into Fun, Not Germs, focuses on the steps that swimmers and caregivers of young swimmers can take to stay healthy when visiting splash pads. To support your efforts to promote healthy and safe swimming out in the field, CDC created a 2025 Healthy and Safe Swimming Week Communications Toolkit. And I will be providing that to you following the seminar today, along with some additional resources that CDC provided. So please be looking for that email. So without further delay, allow me to introduce our guest speaker today. Kristie Riester has been the Executive Director of the Council for Model Aquatic Health Code since June of 2019. With over 20 years of experience in public service, Kristie has held various roles, including Recreation Manager at the Recreation Centers of Sun City West and Community Services Director for the City of Maricopa, overseeing parks and recreation, libraries, and special events. Kristie holds a bachelor's degree in physiology from the University of Arizona and a Master of Administration with a focus in public management from Northern Arizona University. She is a certified parks and recreational professional and has served in leadership roles with state and national associations, including as past president of the Arizona Parks and Recreation Association. Kristie is passionate about public service, education, and helping others with their goals. So Kristie, I am going to pass the floor over to you. I will stop sharing and you can bring up your screen.
All right, thank you. All right, let's share. Oh, it says only one presenter can share at a time. Let's see. Oh, there we go. Okay.
Well, I stopped sharing.
You did. I'm good now. That was weird.
Okay.
Okay. Share.
Okay. Desktop.
There we go.
Perfect. You got
I'll
it.
do that. All right. Well, welcome everybody. Thank you so much for having us, Neha. We're very excited. We love partnering with you, and we're looking forward to being at the conference in July. You all will survive, I promise. It doesn't get that hot. Kind of kidding. But today I'm going to talk about the Model Aquatic Health Code. First of all, what is the Model Aquatic Health Code? It's an all-inclusive model public swimming pool and spa code. It was developed by the Centers for Disease Control and Prevention. It's voluntary guidance. So this is really important. It's not something that you have to follow. It's something that you can follow. I would say it's something that you should be following. You can use it to update your local or state code, or territorial and tribal public health official codes. And I know a lot of people in the operating side of the world use it as well. So it's just great voluntary guidance. It addresses everything. So it is an all-encompassing code, the only one out there, I think, that covers everything. So that includes design, construction, operation, and management needs for aquatics facilities. It's updated every 3 years with collecting, assessing, and relaying national input for CDC consideration. I'm going to talk a little bit more about how we do that as well. So there's actually 2 documents. We have the Model Aquatic Health Code, otherwise known as the MAC, and it is the actual code language. It is very comprehensive. It is, I know it's long. There's a lot of detail and information in there. It is all data driven. It's based on the latest science and best practices. One of the things that we do at the CMAC, at the Council for the Model Aquatic Health Code, is we help drive that process. And so we, throughout the year, have committees that are constantly working on things. We are part of research and all of those good things that make sure that we are putting in those best practices and all that science that's out there. The MAC Annex is an even larger document, and it provides all of the rationale for what is in the Model Aquatic Health Code. It gives all the valuable background information and the data. So when you have a code and you're wondering, I wonder why that is in the code. Why did they choose that? You can go into the annex and it'll give an explanation of maybe where that science or that data came from. And so it gives you a better understanding of why that is the code. How is it different? I mentioned before, the purpose, of course, is to protect public health. It's updated every 3 years. It's available for free, so that is a huge bonus. I know there's other codes that cost a lot of money, so you can have this at your fingertips for free. I know, you know, public health budgets are tight, so it's a great way to make sure that you have the best data and information. It's available on our website. You can go to our website at cmac.org/the-MAC. Or you can also find it on CDC's website at cdc.gov/MAC. It covers, as I mentioned, everything from design to operation and everything in between, and incorporates the best science first. That is the main goal. So as I mentioned, it is a model code, and that means that it's not a federal mandate. It was created as a model code, and adoption is voluntary. As I mentioned, I know there's a lot of people that use it for reference, especially in the operator world. It is commonly referenced in litigation and by aquatics management. So while it's not enforceable unless it's adopted in your jurisdiction, it is something that will stand up in a court of law. So it's very important to be following these things at public facilities. It is flexible, so you can adopt it in whole, in part. You can use it as a resource or reference. You can use it to update your code. And so it's just a really great tool and resource, even if you don't adopt it into your code. So the scope of the MAC, it's intended for public aquatic venues. So it's not it's not for anything that isn't considered a public aquatic venue. So it covers water parks, any like parks and recreation facilities run through, a municipality or a county, YMCAs, hotels, HOAs, and anything else that is considered a public venue. It's not intended to address residential pools. So I think that's something also to be mindful of, if you're, going to a pool party or something like that. This is for public venues. Man-made public venues. So how is it updated? So every 3 years, the process begins with the change request process. So the CMAQ will take anyone is able to submit a change request. If you think there is something in the code that needs to be updated or addressed, you can submit a change request. Anyone can do that. It's only members of the CMAQ. You have to be a member to comment and vote. So the process is managed by us. We basically collect and assess and relay all of the input to the CDC. So we have a change request or a technical review committee, and then we also have subcommittees that help. And so they go through, we have all of the professionals in the industry in the particular areas. They come together, they discuss the change request, make recommendations that are then presented to the CMAQ board of directors, and then they ultimately after the voting has happened, will submit the changes that the membership of the CMAQ has made to, and they pass that on to the CDC, who then considers everything and runs it through all of their different departments and divisions to make a decision on what is going to be either added or changed to the upcoming edition. So there are 3-person committees, and we have various sectors. We have a special committee. So we have the technical support committees for operations, maintenance, lifeguarding, and bather supervision. And then they help the technical, or they provide technical expertise to the review committee, and then that's how that process goes. After the submission window is closed, that's when public comments take place. After the closure of the comment period, that's when we have a conference. So we have a triennial conference, and people can come and share their input, make any comments. Comments can also be done online electronically. And then we have the vote. And then that is when those get submitted through the CMAQ board to the CDC, and then it goes through their process. I don't want to take up too much time, so I think I went over the process pretty well. So I did want to point out the sections of the MAC. There are, these are the main sections. We have the aquatic facility design standards and construction. We have aquatic facility operation and maintenance, and then policies and management. So it really does encompass everything. There's also, this is also a great resource I always love to bring up. It's the mini-MAHCs. So they were created to help agencies refer to specific references. So one of the big things we get from operators is, oh my gosh, what do I do if somebody has an accident in the pool? So we basically, well, the CDC took everything from that's around Cryptosporidium, that's throughout the entire document and stuck it in one document. So that's the reducing the spread of Cryptosporidium. There's also a mini-MAHC on improving swimmer hygiene and diaper changing, as well as preventing inline production of toxic chlorine gas and preventing pool chemical injuries. So if you're looking for something specific that has all, because there can be things throughout the entire document on these areas. And so it's nice to have them all in one place. So the Council for the Model Aquatic Health Code is the organization that I work with. And we basically support the efforts to keep public swimming facilities safe and healthy. So we are an extension to help the CDC facilitate the update process. We are a member-driven organization. I'll share a little bit more about that. So if you're not a member of the CMAQ, we would love to have you become a member. We have a lot of really great member benefits that I'll talk a little bit about. Essentially, we were established during the MAHC development process. We are kind of modeled off of the food code has support via the Conference for Food Protection, and so we were modeled off of that organization. And so, as I mentioned, we're here to facilitate the process and partnership between the aquatics industry, public health. We are an independent 501c3 nonprofit organization that was established in 2014. Our initial funding was provided from our founding sponsors, National Swimming Pool Foundation, Councilman Hunsaker, who has continued to be a lifelong support for us and sponsor, as well as SeaWorld. So that is essentially kind of how we were created, is to help support the CDC with the Model Aquatic Health Code. As I said, we facilitate research and education. We initiate the update process for the Model Aquatic Health Code every 3 years. We facilitate technical support for public health. That's, I think, one of the greatest things that we do is you can call us anytime. My next slide, I'm going to introduce you to our team. Dewey Case is our technical director. And if you have a question, if he doesn't have the answer, which he usually does, but if he doesn't, we have a vast network of people that can help us, that we can direct you to. So we do provide free consultations if you're struggling in a certain area, need guidance, need assistance. We would be happy to help you with that. And as I mentioned, those are free. So anyone can give us a call for any help. We provide support for operators, public health, anyone, all other interested stakeholders. So please reach out if you have any questions. We also have a certification program where you can have, if you, let's say you have a lifeguarding program or a product that you would like to, that's MAHC compliant, you can get that CMAQ certified. So we do have that program as well. So here's our team. As I mentioned, Dewey Case is our technical director. Betsy Watson is our new communications director. And Susan Wickman is our director of administration services. So, but please don't hesitate to reach out to any of us if we can assist. And we hope you'll become a member. Join us. We are a great group. We have an amazing board, very supportive members. You can visit us at cmac.org to join. It's $90 for 3 years. So it's a really cheap membership. You can, if you're a member, you get access to all of our webinars for free, along with free CEUs. So it's a really great benefit if you need continuing education. So those are, when we have a webinar, those are free. The CEUs come with that as part of your membership. So it's a huge benefit. Of course, to make your voice heard, you need to be a member. So to participate in any of our committees or our conference, you do need to be a member to, you don't need to be a member, as I mentioned, to submit a change request, but to comment and vote, you do need to be a member. We have a ton of educational resources. We are always Dewey's put together some really incredible evergreen sheets. Our latest one is a document on safety plans and essentially what needs to go into your safety plan. It's a really great resource. As a member, we do offer discounts on webinars and our webinars are free, but on trainings, we partner with other organizations to offer discounts on registrations and things like that. So that's another added benefit. And then, of course, free access to presentations and case studies. We hope you get involved. We'd love to have you serve on any one of our committees. We do a lot of really great stuff right now. I know cold plunge pools are kind of the rage and are really growing in popularity. So right now we have a committee working on establishing guidance for those. We have done a lot of really cool stuff on special venues, splash pads, artificial lagoons, and surf pools as well. So we're always keeping up to date with everything. With that, I know I went over just a little bit, but let's connect. Please don't hesitate to reach out if you have any questions about the code, about maybe a venue that you're assisting with or providing guidance to operators. Our website's here. Follow us on Facebook or LinkedIn. I know Dewey also posts a lot of really great things on LinkedIn. So if you probably want to follow him as well. He's always got some really great things that he's posting. So thank you.
All right. Thank you, Kristie. That was a lot of wonderful information for everybody. Just a reminder for the audience, if you have any questions for Kristie, please go ahead and drop them into the Q&A option on your screen and I will address them. It looks like I already have a couple questions for you, Kristie.
Great.
First one, why doesn't the Model Aquatic Health Code address natural water venues?
So that's a great question. And we definitely are getting a lot of requests for like mineral pools, things that, are, maybe partially man-made, but filling through these natural water resources and don't have, that aren't treating them. So that's definitely something that we're looking at. We understand that there's, some guidance needed for that, but essentially it was created for man-made public aquatic facilities.
Thank you. And another question, in our state, individuals cannot apply for membership with associations. Can our state, as a state, apply to be a member or a group?
Yes.
Or an office, a department?
Yes, we do have agency memberships. We have like corporate or agency memberships. Yes, so we do have that available on our website where your agency can become a member, and then they can have so many staff that are part of that membership. And if let's say one of those staff members leaves the agency, you can then replace them with someone else that's on the team.
Oh, wow.
Mm-hmm.
That's really
so it doesn't stay. So when you have a corporate or agency membership, the membership stays with the agency. So it doesn't stay with the member. So if that person leaves your organization, you can then have someone else be the member.
That's very cool.
Mm-hmm.
All right. Another question for you. Do you have any recommendations or strategies for convincing hesitant states to update their code? And are there any incentives to switch?
I mean, we're not offering any incentives. This might be a really great question for two of our panelists, Jun and Tom, who are also board members and work for government county agencies. Um, I mean, obviously, it's you don't have to adopt it in full. So if you need to update a certain area of your code, it's guidance. So you can change it however it meets your needs. If you're looking for what the latest research says, I know that there are some agencies that are hesitant because they're worried that it might be a large cost for people, to update. So I mean, you can take it in, you know, in stride, I guess. I know that there's also some agencies that or states that might say, like I know Colorado adopted it by reference. So you can use pieces of it. You can, it's not, you don't have to follow everything, but if you want to follow things that you can. And so I think that, if there's something in your code that you need to update, but you don't want to use all of it, that's an option.
Thank you, Kristie. And can a county fully adopt the MAC if the state's pool code is more restrictive?
I think that you would have to ask your state. Usually, they might say you have to follow whichever one is more stringent. I mean, I would have a hard time believing that the MAC isn't more stringent, but I don't know. I guess it just kind of depends. That's definitely a state question.
I'm going to do one more question for you, Kristie. How do we best socialize MAC and mini MACs with local inspectors and operators? We find that many aren't even aware of its existence. What marketing strategies do you recommend?
Ooh, that's a good one. Maybe that's something I need to talk about to Betsy with. If maybe we need to create some marketing materials for public health inspectors to be able to take out with them. If that's something, any of you guys are interested in, we can definitely look at creating some tools and resources. I would encourage them, when you're on site to, tell them about us, give them our contact information, or the link to where they can find it. We're doing the best that we can to try to get out there. I know that we've been attending like the Association of Aquatics Professionals conference. So there's a lot of operators there that are all familiar with it. And we do have state designees. That's one of our committees. It's a really incredible committee. So we have a representative of public health from almost every state. And so they're pretty active in disseminating that information as well. But yeah, I'm going to write that down. We can create some resources for you to direct them to, or maybe some kind of like a flyer or handout that you guys can share when you go to a facility. So thank you. That's great.
That would be really awesome. All right. Well, thank you, Kristie, very much for your presentation. And I am going to share my screen again and introduce our guest panelists for today. And did that come up for you?
Yes, I can see it.
Great, thank you. All right, so today we have Jun Naotsuka, who began his career as an environmental health specialist in 2005. He has been involved mainly with food safety, water recreation, health and safety, school environmental health, and other living environmental fields. Since 2016, he has been specializing in water recreation, health and safety. Jun has also been a planner reviewer for pools and spas, has led the statewide water recreation program at Washington State Department of Health, and now he's leading beach safety and sewage monitoring effort at Public Health Seattle and King County. He also serves on the CMAQ Board of Directors and the Public Health TA Standard Consensus Committee. Next, we have Tom Fink, who is a registered environmental health specialist for the Cuyahoga County Board of Health, where he has been for the past 21 years. He is currently a supervisor in the Environmental Health Department, while he also serves on the board of directors for the Council for the Model Aquatic Health Code. Tom received a Bachelor's of Science degree in biology from John Carroll University. And lastly, but not least, we have Keila Flores-Burgos, who is a water quality and hazardous waste supervisor at Larimer County Department of Health and Environment. She brings over 15 years of experience in swimming pool inspections with a background spanning both Colorado and Florida. Keila holds a bachelor's degree in microbial technology and has maintained a certified pool operator certification since 2008. She is currently leading efforts to support the adoption of the MAHC in Larimer County. So with that, I will stop sharing my screen. And we will begin our discussion session. So again, to the audience, if you have questions you would like to ask to our panelists and our speaker today, please do use the Q&A, and we are going to try to get to all of your questions today. So I'm actually going to go back to a question that was posed already regarding if any of you have any recommendations for convincing states to update their code. Because that did sound like a really interesting question that probably a lot of people have.
I have one idea about that.
Mm-hmm.
So if your state pool code is outdated, you really want to look at the latest standard out there and think about adopting it, because if something goes wrong and there's a lawsuit or something like that, then the court will look at what the best management practice is out there. And if there is a Model Aquatic Health Code requiring certain things, but it's not required in your state, then the court might ask you, why have you not looked at this issue before? So that's one reason, I think, incentive for state to look at the MAHC and think about updating their code.
And I will agree with June. That's what we're doing here in Colorado. Here in Larimer County, Colorado is a little bit decentralized, and not every county needs to have a swimming pool program, but we do here in Larimer County. So it's more on the local level. And because our regulations are so outdated, it's been really easy not to convince, but to show why the MAHC or adopting the MAHC, it is necessary, because the current regulations here in Colorado does not cover a lot of areas that can impact or create a situation with waterborne diseases or drowning or chemical accidents. So it's been easier to convince to use the MAHC just because our regulations are so outdated. Yeah.
Those are great ideas that people could take to the state for their argument. Tom, did you have anything to add to that?
Sure, yeah. So here in Ohio, unfortunately, we're not going to ever adopt the MAHC as a whole, but we do use it as a reference in a guidance document. And one of the reasons why is because it is, like Kristie said, the latest and most up-to-date scientific-based and factual code when it comes to the aquatics world. Most people, at least in the public health world, are aware of the FDA food code, and this mirrors that, or kind of isn't built in that same kind of light as that code. So when you're going to your state representatives, almost everyone understands when you go to a restaurant, they have to follow the food code. Well, this is the exact same thing. It comes from another government agency, the CDC, that is the whole code itself is science-based. The annex that Kristie was talking about specifically shows the science behind a lot of the codes that are in the actual document. So it's very easy to prove that this is by far the best code that's out there to kind of cover everything when it comes to the aquatics world. And like I said, it mirrors what the FDA food code is for the food world.
Tom, I use exactly that same idea to tell people why. I'm like, you know, the food code, it comes from the FDA. This one comes from the CDC. It's exactly the same. So
correct. Yeah. And
yep.
and just like the food code, it's
Helps.
updated on a regular basis. So it's not one of those stagnant codes where it's just going to stay the same for the next 20 years. People have, like I said, people have no problem updating the food code when the food code changes. So this is pretty much the exact same thing.
Great. Thank you for your answers. I'm sure everybody appreciates those. Another question I will pose from the audience. Do you have requirements for cold plunge pools, and do you have a maximum square footage?
I can say here in the state of Ohio, we do not. And inside the MAC, unfortunately, there's nothing yet. That document and that guidance is being developed as we speak. Sheriff Cheshire, one of our MAC ambassadors that worked pretty closely with us out of the state of Utah, is really on the forefront of developing these guidance documents and these cold plunge pools. She's been approached by numerous states, counties, even other countries in regards to her guidance that she's provided. So we're close to providing guidance. Eventually what will happen is after that guidance is developed, it will get put forth as a change request to get added to the next edition of the MAC. But as far as anything currently in there, no, not as of right now.
Great. Thank you, Tom. Another question for all of you. Some states may be hesitant to promulgate new regulations due to a lot of complications and it being a time-consuming process. What is the best strategy besides threats of lawsuits to approach decision makers? Probably a lot of what you shared on the first question, I would think, but
Yeah, and I for me thinking, because I'm doing it right now, and I'm trying to make these new regulations here in Larimer County, and how to, you know, sort of convince people or our Board of Health of why we need these. Um, One strategy you can use is just don't implement the whole thing, right? Start with the line up if you have current regulations with the MAC and see what is the biggest discrepancy and it actually affects and it's like an imminent health hazard, and start with those and just do it in steps. Do not take on the whole MAC at once, and just go little by little, and then again, using that science, that annex that shows the science behind why the MAC is the ideal code to follow for the swimming pools in your county or your state. I think that's the best way to go by it, because it is big. If you just look at it, it is big. Just go piece by piece, or those areas that you know is lacking on your current regulations will be my advice.
That's really good advice, Keila. Anything else from anyone?
I think every state is different. In our case, in Washington State, it was not difficult because the State Board of Health said we need to update our code. So the decision maker was already supportive. So we had to get started. But well, you know, when I was running the program at the state level, I was getting that nice pressure coming from the Board of Health, and I didn't get started right away because it's so much work. So to give advice to people who are kind of reluctant to get started, I would say, like Keila was saying, you know, manageable amount at a time so that you know you can get it done. So you don't have to adopt the whole thing, but maybe you can look at your code and find the weakest section of the code and just adopt that section from the MAC to update it. That may be a way.
Very good. Another question, we have quite a few questions. So what is the difference between using the MAC as a reference document versus adopting the MAC in parts or in whole? How does adopting the MAC as a reference work in terms of regulating the public? Kind of a two-parter here. So,
I can talk a little bit about the reference portion of it. Here in the state of Ohio, we won't adopt the MAC as a whole or as a part, or even to be honest with you, as a reference document. What we do use the MAC for is for when we do update our codes. Now, granted, our codes haven't been updated for a while, but we will pull language directly from the MAC and put it directly into our code. Since that model code is already written, or the model is already written in code form, we just take it directly from the MAC and put it directly into the code. Now, as far as adoption by reference or adoption as whole, obviously adopting it by whole is basically you take the MAC and you put it into your state code, and then that's what you are required to follow. Parts, you can adopt certain sections of it, however your state legislature or your board of health or whatever it might be want to do it. And then I'll let one of the Jun or Keila regarding reference. I think you guys are looking at it that way.
I'm not too knowledgeable about adopting it as a reference. I think what it means is in your state or county code for the pool regulations, it says we reference the MAC version whatever year, and that's what it says. So when people see that, they have to go to the MAC document to find what the actual regulations are, as opposed to adopting the MAC is you take the language and put it in your code language. So that's your code without referencing. That's how I'm understanding.
Yep, that's correct, Jun.
great.
So that's why the state of Colorado, the Colorado Department of Public Health and Environment, that's what they did. So if you go to our very outdated regulations, it says that they are adopting the MAC as a reference, and it has the MAC there. And then that's it. You have to go to the MAC to look for anything. The way we're going to do it in Larimer County is we're adopting the MAC. So we're taking the verbiage from the MAC and making our regulations that way. So it's the MAC, it's our regulations now. Will be if the Board of Health approves in the coming month.
Very good. Is there anything in the MAC regarding swim up bars?
I don't think so. Not that I'm aware of.
Yeah, I don't think it's addressed explicitly.
What are swim up bars? In case anybody else is wondering.
I'm assuming is when you have those like resort style bars that you can sit inside the water, you're in the pool and you can drink at the same time. So I'm not sure what actually, if that person can explain or ask a little bit more, I will be curious to know if they're thinking on, if you can drink from a glass cup or just plastic because you're inside the pool and we don't want glass inside the pool. So I'm not sure, or what more information we can get from that question to probably help with the answer.
So whoever asked that question, if you want to add a little bit more info for us, that would be wonderful. What are the key differences between the MAC and the ISPSC? It looks like our state is moving towards the ISPSC instead. So what is the ISPSC?
International Swimming Pool Code.
Oh, and spa code.
Spa
yes.
code.
The difference, I would say, I might be wrong or biased, but ISPSC is more for building departments. So the building officials use that document a lot, as opposed to the MAC is for public health officials. In some states, they adopted ISPSC, so it's the building department who regulates the design or the construction of pool facilities, and the operation aspect of it is regulated by health departments. But in Washington State, both the design and operation are regulated by the health department. So we use the MAC a lot, although we also reference ISPSC as well.
Yep. And I will, I'm going to be biased as well as a board member on CMAC. The MAC is, I like the MAC better than the ISPSC, whereas June mentioned it's focused, the ISPSC is focused heavily on construction, whereas the MAC is all encompassing. The MAC has everything from construction to operation and maintenance, and safety, stuff like that, whereas the ISPSC focuses very heavily on construction.
And then, Tom, remind me if I'm wrong, the new 2024 MAC, it's more in alignment with the international, right, than previous versions of the MAC, right?
Correct. Yeah, there's a committee on both PHTA, which maintains the Pool and Hot Tub Alliance, which is the organization that maintains the ISPSC, and then us, CMAC. There are committees in both organizations that are working together to harmonize the two documents. So we're working towards making them this is very similar. I doubt they'll ever be the same, but working towards getting them to both be as similar and as close as possible.
All right, next question. In what situations does a pool operator have to contact a health department? Do they need to contact a health department if there is low or high pH in the aquatic venue, or if there is fecal contamination in an aquatic venue, or all of the above?
I can speak here in Ohio. In Ohio, it's whereas, like I said, we don't follow the MAC as a whole. What's required to contact the health department is only if there is a major incident. Those include anything from drownings to significant injuries, basically anything if there was any kind of life-saving work or CPR performed, if the squad, if an ambulance or medical squad had to be contacted or called, those are the stuff that has to be required to the local health department. For those other instances, the chemicals being off or a fecal incident, the pools are required to follow the rules and then document in their records what they did, and the fact that that incident did happen, but they're not required to actually report it to us. So when we go out to do our inspections, we just verify that those were taken care of properly at that time.
Same here.
Same there.
Yeah, I echo what Tom said. In Washington State, our code says that if there's an illness or injury, then they're supposed to the operators are supposed to contact the health departments so we can investigate. I'm trying to remember what the MAC is requiring, but I don't remember off the top of my head.
Let's see. Does your jurisdiction treat Airbnbs and VRBO pools as public pools? And if so, how strict are your requirements for those pools?
Well, I can go. Our definitions of our regulations in Colorado are only for public pools and semi-public pools. Public pool is your hotels, mobile home parks, health clubs, semi-public pools, the opposite. Semi-public pools are hotels, mobile home parks, fitness centers, and the rest is public. Private here is condos and apartments. So most Airbnbs and VRBOs are condos or apartments. So we are not regulating those right now. Not sure if in the future any changes on the definition of what is a public or semi-public pool will change these, but as of right now in Colorado, we do not regulate anything that is considered an Airbnb or a VRBO.
Is that the same also, Washington, Ohio?
It's very similar to what Keila said in Washington State. If you look at our code and the definition for water recreation facilities that are supposed to be regulated, I would say that those rental pools would be included. But then it says if it's at a single family dwelling and used only by the resident and their invited guests, it's outside of the regulation. So it depends on how people interpret that term invited guests. So we're trying to clarify that, and we're right in the middle of that process, actually.
Yep, Ohio is basically the same as in Washington. It's our public pool code says a public pool, so we license anything that services more than 3 families. So it kind of falls on that loophole of that family is inviting those individuals into their house. So that's kind of where we're at right now. So yes, we would love to. I wish we did, but no.
All right. I just see a question over in the chat. I'm gonna ask you guys. Can a territory outside of the US adopt MAC?
Yes.
Yes.
Yeah.
Yeah,
Absolutely.
I think so, yeah.
Guam adopted it. I know Kristie could probably answer this question a lot better than I could. They're doing it in Kristie, where were you just at? Now I can't remember.
Yeah, so
Saipan.
and actually I am going back to Saipan with Chris coming up, and so I know we're helping the Northern Mariana Islands create some guidance. Mexico City follows it. We just heard that Colombia is, and there are some United Arab Emirates that are looking to utilize it. So yeah, it's definitely international. I know we have some friends and colleagues in Canada that also reference it. I'm not sure if any of their areas have adopted it, but it's definitely being used internationally.
Very cool. Very cool. All right, I'm going to pose another question. In public pools, we determine the water clarity if the drain is visible from the pool deck. How do you determine water clarity in splash pads or in water slides, since turbidity meter is not required?
So for water clarity, we only require any kind of standard for water clarity on water that is standing, or so it's something that's holding water. So splash pad, we're not looking at water clarity because the water, the recirculation tank is not accessible. No one's swimming in that water. So we only worry about water clarity in pools. For slides, it is very difficult. So if you have an activity pool that has a lot of special features that's churning up the water, with that turbidity, it can be very difficult. So we try to make sure that the still look and see and make sure that main drain is visible from the pool deck.
Okay. Any other advice?
Just to add to what Tom said, in Washington State, our code has a requirement for water clarity, so you can see the bottom of the pool, and also water turbidity. So it is a requirement in Washington State. And clarity is for safety. You can see through the water, so you know what's underwater. And turbidity is more for protecting health. So the water is clear enough. There's not too much gunk floating around, so the disinfectant can work to kill germs. So in that sense, splash pads and water slides you might want to have clear water there too. But I don't believe there's a turbidity requirement in the MAC. If I'm wrong, please correct me.
Okay. I am going to go on to the next one. For splash pads that recirculate, it's good to see the 3 log reduction for crypto recommendation. For other treatment loops, the recommendation is 2 log. But those other settings involve standing water and exposure to mostly untreated water. While there is greater dilution with pools, for example, an actual contamination event would warrant maximum possible log reductions, and then the difference between 2 and 3 log may not be quite justified. Why not alternatively just recommend 40 mj square centimeters, the standard commonly available UV dose for drinking water treatment for all venues, for all treatment loops, which would achieve a high level of inactivation? This would be better to protect those being splashed or sprayed when, so I don't think there's a question. I think they were just sharing something. All right, thank you for that. Are there any accompanying guides for pool inspections to check for MAHC compliance?
There is an actual course that the CMAQ just came up with, the Aquatic Venue Health Inspector course, that I think is being presented at NEHA, if I'm not mistaken.
Yes.
So yes, there is a course that is being presented now that it was just put together. So be on the lookout for that around the country.
Awesome, cool, thank you. Another question, for a pool shared by a very small apartment/residential area, what is the minimum residence number that determines a pool to be public?
I think that is different for every state. Like we had mentioned before, for Colorado, that will still be a private pool. No matter how many residents can be in the pool, they will still be a private. Having that apartment and residential area just makes it a private in Colorado.
Same for Washington and Ohio, I would assume.
In Washington state, if you have fewer than 14 or less living units associated with that place, then those pools and spas are not regulated under our code, but regulated by the building code.
Oh.
And
Similar
so-
in Florida. Florida is very similar. Yep.
Yeah, in Ohio, we're a little bit stricter. It is if a pool services more than 3 families. So an apartment complex that has 4 units would be considered a public pool and would have to fall underneath our licensing regulations.
Wow. All right, great. Does the MAHC or any associations you know about provide any guidance on the approval of lifeguard curriculum? Our state reviews lifeguard curriculum, which can be offered in the state. So just wondering if there is any available rubric that can be used for the evaluation of submitted curriculum.
So Kristie, correct me if I'm wrong, but we do offer MAHC certification for a lot of lifeguard classes and curriculums.
Yeah, and I know Dewey has a guidance that he goes through. So please reach out to either myself or Dewey and we will share what we have.
Great. And I was going to actually say, if you share some of these with me, I always do a follow-up with everyone that is in attendance with us today. And I could include that in my follow-up to everybody, all the resources that you guys are mentioning, because these are all wonderful and great. All right. I'm going to take one more question. Yes, and then we'll close out. Do your jurisdictions include regulation of HOA pools?
Yes.
Yes.
Not here.
Not in Colorado. Okay.
Hoping
June,
to
what
change
about
that.
June in Washington? Do you guys cover HOA pools?
Yes, we do.
All right. For everyone else that has questions left, I'm going to leave that open for our panelists. If you guys could go to the Q&A and see if you guys could reply in writing to those few questions that are left in there. And I'm going to go ahead and share my screen again so I could do the closing of today's seminar. All right. So that was a really great session, and I think everybody today learned quite a bit about the MAHC. So I would just like to give a big thank you to our guest speaker, Kristie Riester from CMAQ, and thank you to all of our panelists, Tom, June, and Keila, for being here today. You guys answered quite a few questions and provided a lot of really great information. We have one final request for each of you that joined us today. Please take 5 minutes and provide your feedback on today's seminar. You'll receive a link to the evaluation just following the seminar closing. Your feedback is very valued and assists us in being better able to meet your needs in future seminars. Lastly, just keep an eye out for my follow-up email with all those resources that'll be coming to you. And thank you again. Wish all of you a great rest of your day. Thank you.